This is a simulation series on Atrioventricular Block by EcgKid Portal. In this series, you will learn to analyze each type of AV block by the real-time simulator rhythm. Along you will be able to distinguish the ECG features of each of the AV block. First thing first. First of all, we will explain each of AV block along with live simulator and its mechanism and some of the ECG features. So, let's get started. First-degree AV block results from a prolonged transmission of the electrical impulse through the AV junction, AV node, and the bundle of His. The significant finding of this rhythm is a prolonged PR interval of more than 0.20 seconds. When electrical impulse travel from SA node to AV node, there is no abnormality, but when the impulse enters and leave AV junction there is slight delay. This result in prolongation of P to R interval on ECG. The normal PR interval is 0.20 seconds. In first-degree AV block this interval is more than 0.20 seconds. Although R to R interval is constant, means a regular rhythm, and origin of impulse is SA node, so it's sinus. The underlying rhythm should be identified and named prior to claiming a first-degree AV block. For example, this rhythm is a normal sinus rhythm with a first-degree AV block. In second-degree atrioventricular nodal block, also known as Wenckebach block or Mobitz type I AV block, varying failure of conduction through the AV node occurs, such that some P waves may not be followed by a QRS complex. Unlike first-degree AV nodal block, a 1:1 P wave to QRS complex ratio is not maintained. The second-degree type I avenue block is distinguished by an increasing delay in AV nodal conduction until a P wave fails to pass through the AV node. A second-degree type I AV block occurs when conduction within the AV node itself is delayed in this progressive manner. This causes irregular RR interval and progressive prolongation of PR interval. This is also called 2:1 block. Second-degree AV block or Mobitz type II. There is intermittent non-conducted P waves without progressive prolongation of the PR interval. Mobitz II is usually due to failure of conduction at the level of the bundle of His and Purkinje system. Type II Mobitz block also usually occurs with a fixed P/QRS ratio, with a set number of P waves for every successfully elicited QRS. This ratio is also frequently specified in referring to 3:1 or 4:1 or higher Mobitz type II block. Third-degree atrioventricular block, or complete heart block, is a medical condition in which the nerve impulse generated in the sinoatrial node in the atrium of the heart cannot reach to the ventricles. Because the impulse is blocked, an accessory pacemaker in the lower chambers will typically activate the ventricles. This is known as an escape rhythm. The P waves with a regular P to P interval or sinus rhythm is presented as first rhythm. The QRS complexes with a regular R to R interval represent the second rhythm. The PR interval will be variable, as the hallmark of complete heart block is the lack of any apparent relationship between P waves and QRS complexes.